Hey guys, I am back with another video. So today we will be going over taking care of the surgical patient. So we're about to go over the phases of surgery. So we have our pre-op phase, and this is the phase once the patient has decided they wanted surgery until that patient actually gets on the OR bed. Our intra-op phase is once that patient is on the OR bed, and then it ends once they get to the PACU. So the PACU is our post anesthesia care unit. So if a patient received anesthesia, they're going to go to the PACU to recover. All right, so that phase ends once the patient gets to the PACU. Post-op starts once the patient gets to the PACU, and once the patient, either they go home from there or they go to the floor or whatever, but they're gonna that's the post-op phase. It's the time after the surgery, after you are out of the PACU. So there are different classifications of surgery, and this is important to know because a lot of times patients, especially some patients who have like chronic illnesses and like terminal illnesses, they may be thinking they're going for a curative surgery when it's really just a palliative surgery. So with our palliative surgery, we're going to be focusing on giving that patient some type of pain relief. It's not going to be for a cure, as in curative. Hey, we're trying to cure. Corrective is what we're trying to do. Correct. Cosmetic, this is your BBLs, this is your boob jobs and all those stuff like that. Diagnostics, we're performing the surgery to diagnose a disease. So this may be a biopsy or something like that. Reconstructive, we're actually reconstructing, we're fixing something. So you definitely want to make sure you know your classifications of your surgeries, and based upon the degree of urgency. So is this an emergent surgery? Is this an urgent, or is this elective? As we can see during COVID, a lot of elective surgeries got canceled. So a lot of patients, who needed their gallbladder removed, all that stuff was postponed. Like your boob jobs, all that stuff was postponed. So knowing the degree and the urgency of surgeries matter. So during the pre-op phase, you are responsible for the pre-op assessment. So during this pre-op assessment, it's like a whole checklist, and it varies from facility, but it's like a whole checklist of things that you need. So the health history will be on there, allergies, your head to toe assessment, baseline vitals, height and weight, and all that stuff, and skin preparation as needed, right? So NPO, what is NPO? Nothing by mouth. The biggest and the easiest way to get a surgery canceled is by not enforcing the NPO order to your patient. So if your patient eats or drink after that cutoff time, then guess what? That patient will not have surgery. And what is the reason that they don't want your patient eating or drinking before surgery? Correct. Aspiration. They don't want your patient to aspirate after they get that anesthesia and their gag reflex and all that stuff is gone, because the anesthesia has relaxed them. So medication administration, sometimes they want you to give medications, antibiotics and stuff before surgery. So you always want to look at your pre-op orders. So you will have an order set of orders that you need to follow before that patient goes to surgery. And if a patient doesn't complete one of the things on the checklist, that could postpone their surgery. And I just want to let you guys know that the surgeons will not be happy with you. So you want to make sure that you are getting this stuff in order. All right, so you want to remove items prior to surgery, such as jewelry, dentures, makeup, and all that kind of stuff. You want to make sure that stuff is removed. And one of the biggest ones is that we really don't think about it is psychological support. We want to make sure that we are supporting our patients, because knowing that, even even if it is an elective surgery versus like a curative surgery, anytime you go into anesthesia, it is a big deal. So a lot of patients are scared. So some nursing diagnoses could be anxiety, could be, like the patient could really be apprehensive about it. So you want to make sure that you are addressing those concerns as well. So when I talked about the surgical checklist, so the informed consent. So your job as the nurse is to make sure that the informed consent is completed, and you can serve as a witness if you was there while the physician was going over. So informed consent basically is that patient consenting to the surgery. The patient saying, yes, I understand the surgery and I understand the risk of the surgery. That is the physician's job. I'm going to repeat. It is the physician's job to explain the surgery to the patient. If your patient is getting ready for surgery, the surgery is in 30 minutes, and you already then gave report to the PAC, you already gave report to pre-op, and they're ready for your patient, and your patient says, Nurse Kim, I don't know what surgery I'm getting. What they gonna do when they get in there? What they gonna do? And first you're gonna say like, did the doctor explain this to you? He did, but I still got some questions. You as a nurse cannot answer those questions. It is the doctor's job to come back in and explain that procedure to that patient. All right? All right, so pre-op education, routine care, explain special post-op equipment. So you want to let your patient know during pre-op what they can expect to experience after surgery. So when you come back, hey, we may have you on a blood thinner to prevent blood clots. We may have you with SCDs on. You may have to use the center spirometer, right? You may have to get IV pain medicine because of the pain. So you want to give routine care type of explaining to your patient. Explain to them that, hey, you'll be on some antibiotics and all that kind of stuff. But you may say, Dr. Bonner, how am I able to explain some of this stuff? How am I supposed to know? Well, that's why you're learning now to know general surgical type of routine process that we do. Also, you will have your orders there as well in the computer. You will have your post-op orders there as well. So you want to explain to your patient about different breathing exercises, coughing, deep breathing, right? Because we want to prevent that patient from having pneumonia. So we will talk about post-op complications later on. All right, so informed consent, I got a little ahead of myself, but remember, it is the surgeon's responsibility to attain consent. The nurse verifies and witnesses the consent only. All right, so interventions. So you want to make sure that all the things on your pre-op checklist is done. We want to have the patient to have most recent blood work done, so their CBC, their hemoglobins, and we also want to make sure that they also have a blood consent done. So we can get blood consent, and that is just telling the patient, hey, this is in case, and the blood consent normally is in the informed consent, but we always get a separate one because that patient may refuse blood. So we want to have that in there, and we want to let the doctor know, hey, this patient refused blood doing, if they would need blood after surgery or during surgery, they refused it. So we want to have their most recent labs. If we come back and their hemoglobin is really low, we don't want our hemoglobin low, especially if you're not expecting it. We don't want our hemoglobin low before surgery. Our platelets, we want to make sure our platelets, your patient may be bleeding, is going to be bleeding during surgery. So we want to make sure that our levels are intact, and if they're not intact and up to par, then we need to contact the physician and let them know. But we want to reduce anxiety and fear. We don't want to give false hope. We do not want to give any false hope. We can encourage our patients, but we don't want to give false hope. We want to maintain patient safety, manage nutrition and fluids, manage bowel needs. Go and tell your patient, hey, let's go to the bathroom right now, before surgery. They may or may not get a Foley during surgery. Maintain skin integrity, provide pre-op medications and